Hi, Daniel. Welcome to the office. How can I help you? What brings you here?
I have lower back pain.
Okay.
Gets stiff a lot after I do exercise, run, or do heavy lifting.
Heavy lifting meaning workouts or heavy lifting work? Work.
Yeah.
Bending and twisting a
Yes.
lot? Oh, yeah. Okay. How long has this been going on?
Well, the pain started after my accident about 6 years ago.
What was your accident?
Bicycle.
What
I
kind
got
of,
hit by a car on my
what kind
bicycle.
of bike?
Fixie.
What?
A fixie.
A fixie?
Yeah.
Okay, cool. You got hit.
Yeah.
You were obviously on the street.
Yeah.
How did you get hit?
I was crossing the street and the lady driving the car was distracted on her phone. She ran the red light and ended up hitting me.
From the side?
Yeah.
Okay, and then what did your body do?
Well, I rolled over her car and landed about 3 to 5 feet
Okay.
offwards, and yeah, that's about.
Did you go to the ER?
Yes.
Did you get fracture or break anything?
No, broken, nothing.
Good, you were safe. Awesome. Anything in the neck or anywhere else?
Well, the pain recurs like my middle back and then my neck pain a lot.
Okay. Anything shooting?
Yes, like in my lower back, I get these like puncture, like needle points, and then I just feel it flowing down to my knee.
Any shooting pain down the shoulder or arms?
No.
Okay. Any major slips, falls? Besides this, 6 years ago, were there any other traumas or accidents?
Yes.
Yes.
There was 2 more accidents after that.
After that?
Yes.
Okay.
So the first one where they told me that my back was, had that disc problem.
From the car accident?
Yes.
Okay.
So 2 years.
Okay, go on, sorry.
2 years after that, I had another accident, car accident.
Okay, were you hospitalized?
Yes.
And did you break anything?
No.
Okay.
Nothing.
Any new stuff show up from the second accident?
No, it's just same problem with my lower back.
Just made it worse.
Yes.
Third accident?
Was
Don't tell me you got hit again.
No, it was actual car accident.
So you were in an actual car?
Yes.
Okay. Same thing, hospitalized?
Correct. Yes, I was pinned into the seat crunched together, and
Okay.
my seat and the steering wheel, they got like squished together. So I was stuck in the seat. My knee was punctured. My back was in an awkward position. My seatbelt was stuck, so I had to be pried out of there.
Jaws of life? They had to pry you out, right?
Yeah.
Okay. Anything break though?
No, nothing broken.
Let's start the journey.
No.
You ready?
Yes, sir.
Come over here, please. All right, so this is a picture in time. We have 24 bones in the spine, 24 movable bones in the spine, 23 discs in between. And then we have the foundation, which is the sacrum and the pelvis. Okay? And the first thing is, do we have a level base and foundation to have a stable building? So we need to look closer first here. Okay? And let's do that. And the first thing I need, we have a couple of things going on in his low back. You can see there's a short leg on the right, yes?
Yes.
Right? It's down on the right. But the other thing I want us to see is this. You have what's called a transitional vertebrae. 4, 3, 2, 1. This is T12. This is L1, L2, L3, L4. Your L5, you can see it, has taken on the characteristics of the sacrum. It's fused there, it's fine, but it is there. So on the side profile, guess what? You don't have an L5S1 disc, dude. You have an L4, L5. Mira, they told you that one. That's your L5 disc. It's fused. And it's not a bad thing in your case here. Why? Because it's completely fused. I have patients that are partially fused and they're more unstable. This is your L4 disc. It's not L5. Okay? And I want you to see something here. So he has a slightly longer tailbone. That's okay. We have a couple of these nubs here. Do you see that? Those are your old tailbone injuries. And those are before this trauma. Those are when he was a kid. He played. He was very active, yes? Very, very active, I'm assuming. You played sports in high school?
Yes.
What sports?
I tried football, cross country, track, anything that had to do with running.
You're a runner.
Yes.
Awesome. Okay. So we need to talk about your running, and running right now is not good for you.
It is not.
Yeah, and let's show you why. When we're looking at the side profile, I kind of stuck on the side. We'll go back to the other one. First thing we'll do is let's look at your posture, okay? And we're going to run a plumb line straight through. And what you can see here is, it's not so bad, but I want to explain this. So this line should bisect 2, 3, 4, 5, 6, and 7. Your neck is actually in front. Most of the times you hear me talk about it, it's behind, yeah?
Mm-hmm.
Your case, it's in front. Why that's important with you is we have anterior, or we're forward. So if we go here, hold on. Okay, so what I'm showing here is that the neck, or C2, is 10 degrees forward from the base. And that slight forward head carriage is causing what? The research shows for every 1 degree past neutral, right? It's an extra 10 pounds on the lower cervical spine down here. So it's as if we got an extra 100 pounds you feel like you're carrying here. Sitting long times, standing long times. You get it across your shoulder, I'm assuming.
Yes.
You get it across the shoulders. Okay. Now, let's go back. Does this make sense what I'm saying? Do you see what I'm showing you?
Yes.
Okay. Let's go back to this now, okay? And let's talk about this foundation, because this is what we got to figure out with you. We know this is down on the right. I need you to see this before I change slides. You see how the sacrum is bent on the right.
Yeah.
So there's that component with the transition causing fixation and causing you to favor that right side. Okay, now let's look at the numbers. And now the numbers should make sense, hopefully. Let's see. Okay, so what we have here is this. The numbers, PI2, IN6, P4-L. We have a actual difference, 12 millimeter short leg on the right. Correction of the pelvis will make it worse. So the answer is not in the pelvis, even though we need to work on the pelvis. The answer in the fix is going to be somewhere in the sacrum. Okay? Now, I want you to see two things here. There's a 4 millimeter inferiority of the sacrum. Yes?
Mm-hmm.
It's dropped 4. So this is 12. 4 of the 12 is from the sacrum, so it's really at 8 from the pelvis. 8 from the pelvis, correcting this will make it 9. You're still young enough, okay? So there's still, am I fixing a transitional vertebrae? No. My job in this case, Mom, so we're clear, is to stabilize your foundation and figure out what's your stability. And you will have some maintenance down the road. Okay, just like people go and get their teeth checked twice a year. It may be something like that. Okay? Does that make sense so far? Now let's go through the numbers. PI goes down 2, IN turns in. The sacrum on the left goes back. So what is it, the overall effect? Your body wants to go left, but your short leg brings it back right. So I'm pretty sure we're going to get the waddle in your walk. Okay, that's where that comes from. All right, so we have something down low in the sacrum here. Yes? We have the pelvis, and we have this. Now, we got to get this under 7. So we may be putting a heel lift in for stability. Okay, I'm not doing anything right now with it.
Mm-hmm.
I'm just letting you know that this needs to be under 7 for adjustments to hold.
Okay.
Okay. All right. Now, some digestion stuff. I'm not going to go into all that right now. We can deal with that later. Right now, we got to get your back stabilized and get you some pain relief. Okay? So, I need you to see this, though. So, what's it doing? Your foundation wants to go which way? The foundation wants to go left. The short leg is bringing it back to the opposite side. And what is the body doing in response? So it's going this way, but the short leg wants to bring it back. So you're getting that disconnect here in the middle of the back. Okay? From the middle of the back, there's a slight little kink there. The question is, did the kink come from a trauma or a compensation? You got stuck in the upper back, right here, right there. Whether that was a sport or a car accident. T1, T2, T3, número 4. You see what I'm showing you?
Mm-hmm.
It's off. T4. So we have a potential at T4. We have a potential down low in the foundation. You have some jaw deviation. If you want me to deal with it, we'll deal with that as well. And here's what I want you to notice here. Okay, this is important. You see how your spine wants to go this way normally, right?
Mm-hmm.
And then it kinks hard this way. Okay. And this is causing your neck. So from T4, the whole thing wants to go to the left side or list to the left side. And that T4 is coming from somewhere in here. Somewhere in there. And all of it is a function of the short leg and the sacrum. Does that make sense so far?
Yes.
Okay. All right. Let's go back here and look at your discs. Overall, you have good discs. Now, let's see. That's L4. That's your L5. This is your L5 vertebrae, which is fused there. Okay, sir?
Yes.
L4, L3, L2, L1, T12. Oop, wrong X-ray. There we go. Cool. The rest of your lumbar discs are good. These circle patterns are because of the slight tilting. You're seeing a different appearance of it. These discs are all good. These discs are all good. Your neck discs are good. C2, 3. C4 has a little pinch on the back. I had him do flexion extension. Yeah. Now, when you go back in extension, they should all move back. When you go in flexion, they should all move forward. What happened, dude? That one didn't move forward. That one didn't move forward either. You see how that's blocked right there? Yeah. C2, 3, 4, 5. 3, 4, 5 keeps the diaphragm alive. Breathing. Anxiety. Getting those deep breaths. When you're running, I'm going to get you some more oxygen. C5 is also part of the hand, upper body. C5 has connections to thyroid, energy. I'm just giving you some examples, okay? I'm not saying that caused all that stuff. But we definitely have something there. So we have a potential at C5, we have a potential at T4, and we have the foundation.
All right.
Questions?
None?
Let's get started. So, what I want us to do is we're going to watch the dimples. And as I was saying, the right side is shorter and the left side is higher. Let's go ahead and walk, please. Several times. Just keep walking. And have you historically walked with both of your feet out like that?
Till I remember, yeah.
Yeah? Mama, he walks like this, both feet out?
Mm-hmm.
That you remember?
I don't know.
Okay. And you can tell because of the right short leg, he swings the right leg. You notice that, right? The right leg, you don't plant, you do this. So this is his walk. You're doing this. You're swinging that leg around because of that shortness. Keep walking, please. Okay. All right, let's get started. Go ahead and have a seat over there, starting at the base of the neck. And the first thing we're getting is 10 points. C5. C5 left side. T4, 10 points left side. Good. Sit up a little straighter, sir. This is how he should be sitting. S3, S4, down low. There. S3, S4, T4, T5, C5. Those are the three areas that I'm getting. Let's check the movement in the pelvis. Scoot forward, please. Feet together. Curve a little, sit straight if you can. This is where the block is. Feet together, open and close the knees, please. Open and close. Good. Left side only. Open and close. And as he does that left, there's a little movement in that right. Right side only. When he does the right, there's a little more shifting of the left side. Sit back, but overall it's not so bad. Scoot back for me, please, sir. Sit up straight. Mira. Cuatro. That's number 4, okay? Back towards me. All the way back. 5. Tender, yes?
Mm-hmm.
But 5 is the transition. There's nothing to adjust there. That's S1. Tender.
A little bit.
S2. C. S2 on the right. You gotta go one more. S3.
Yeah.
That's the sharp one. Yes?
Yeah.
Okay. S3.
Yep.
S3. Okay. Static palpation. Head down, please. Round your back. As we statically palpate, right about there is where we start to get the change, right there. 1, 2, 3, 4. 4, 5. Donde le duele más? Number 4, number 5.
Number 4.
Number 4. Okay, now let's check the neck. Daniel, is it making sense what I'm doing and showing you?
Yes.
All right. Sit back for me, please. Alrighty. Siete, 6, 5. Yep. See?
Mm-hmm.
5. C5, T4, S3. Those are the 3 majors we're going to start on today. After that, I'll have you walk. I will tune up the shoulders. I will be tuning up the ankles as well.
All right.
And if there's anything else I see along the way, we'll deal with it.
Sounds good.
You ready for me, sir?
Yes, sir.
C5. 3, 4, 5 keeps the diaphragm alive. Left hand up, please. And down. We're putting the seatbelt on, Mama, so he doesn't get out of here now, okay? He's here now. Feet out, resting on your heels, please, all the way up. Good. I got to tighten it up a little. Okay, Daniel? Just a tiny bit more. Okay, feet out, palms up, resting on your thighs. Good. Now, C5. He also has a lot of flexibility in his neck. And I want to make sure I'm not like that too much. Right? C5, we want to, there you go, lift up. Let's get a tiny bit more. I want to lift a little more. Tighten it up. Up. That's the home run, brother. Gotcha. Slide up a little more, sir. Bueno, we have a short leg on that right side, correct? So we need to torque it to get that side up. Bueno, inspire. Sáquelo. Otra vez. And that's the home run. All right, that was S3. And in the middle of the adjustment, the battery died. So we're switching to the iPhone 12 now. 1, 2, 3, 4. Respire. Sáquelo. Gotcha. Nice. I know you have anxiety between C5 and T4. You have a lot of breathing and stuff. Step off. Give it a second. March in place. Now, let's walk back and forth several times. And you'll tell us what's different in a minute. ¿Qué es diferente?
I don't feel like, I don't know, I don't feel heavy in walking. I don't feel like I'm being dragged down.
Is that what you were feeling coming here?
Yes.
Like you're being dragged down,
Yes.
or your feet are just dragging in heavy?
Yes.
Yes. Cool. Okay, so let's rescope, starting at the base of the neck. C5 is 0. T4 is clear. Nice. Ah. Mira. 0, 0, 0, mama. 0. 0. Awesome, dude. Scoot forward, please. Feet together. Open and close the knees. Left side only. It's different, yeah?
Yes.
Right side only. It is so much smoother. You do feel that, yes?
Yes.
Sit back for me. It's not camera tricks, right? Sit up straight. Mira. Número 4. Número 5. 1, 2, 3. Different, yeah?
Yes.
Yes. Perfect. May I continue?
Yes.
Ears. Shoulders. Nice. Over, around. For the feet, since we got a good set on the sacrum, I'm not trying to yank your feet. You've seen me do it 2 ways, pull them or use the board. We'll start with the board today for you. Okay? And lots and lots of walking this week. Raise your right leg, sir. Raise your left leg, please. Astalis, medial tilt. Nice. Stand up for me. Any questions so far?
No.
Okay, let's do the hands then. Stand up, squeeze, 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 squeeze. Elbow, wrist, radial head. That's fine. Nice. Turn this a little bit. Nice. Good. 5 times fast. Squeeze hard. Yes. Squeeze. Yes. Okay. Mama, you have questions for me?
No.
Questions?
No.
Welcome to the office.